things that we're going to address, and these are the information to include in your in along with your clinical documentation. So the first is demographic. So in your documentation, it's important to have your clients' age, gender, status, income, and education, and so forth. So another name for demographic is identifying information. So ensuring that we have that. Now, when we used to do in-person sessions, and when I do group supervision, I often ask for any of the counsel who are presenting a case to actually draw a genogram. And the genogram, can be helpful in terms of identifying, your client system and the support that they have around them. Now, I don't do that in group supervision anymore because I don't know how to do that through Zoom. But so this is a genogram. That can be included in your case notes, but that's just optional. I'm just wishing to share the various information that we can include in our documentation. Okay, so identify. Okay, then presenting issues. So okay, so the history of the books. Thank you for turning off your microphone. Okay, so presenting issues. Okay, and we're gonna go over in terms of how to write that. For me, less is more. You want to keep in mind about whatever you put in the documentation. I mean, it could be used in court, right? And so just being mindful of that, the information. So for instance, if I'm working with a client with a history of, detailed history of, let's say, sexual abuse, childhood sexual abuse, I'm mindful not to write that specifically in the notes, but more about client expressed childhood trauma, okay? And so let's say client talks about like a neighbor, name and so forth. So be mindful not to use other people's name that the clients mentioned in your documentation. Having said that, though, if your notes are subpoenaed, to court, whatever notes we hand in, we need to wipe out or mark out, with all the other names that the client mentioned, just the client's name, and using the client's initial AC, AB, rather than the actual name. Okay. So assessment. Okay. So that's two. So a demographic. We have a brief context of the client's issue. Okay, so the presenting issue gives a brief context. Okay, then assessment and diagnosis. Now, moving forward on the site has two diagnoses, and these are standardized diagnoses: anxiety and depression, and it's self-report. And so you may use it if you wish. And I will talk a little bit about the purpose of that. So it's Beck's inventory assessing anxiety and depression. Now, we don't work with diagnosis, so why do we include that? Or so why should we wish to include that? For me, twofold. Okay, so yeah, okay, so I find it useful, not so much for me, it's so much for the client. And it's like this, it's not to like record that they have high anxiety or they have, depression. I mean, anxiety and depression are, is a mental health, experience that is somewhat normal in our society these days, especially with what's happened during COVID. So it's not about whether they have anxiety or depression. We all do at some point, so that is normal. The reason I use it is really to record the client's success, how well they are doing. That's how I present it to the client. So at the initial session, we record the anxiety and depression and find that it's somewhat high or severe. Halfway through, we can do it again. And then we can see the decreases in terms of how well they're doing in terms of anxiety and depression. And then we can do another one at the end. So I use this to really record and let client know how well they are doing, right? So it's, yeah, so that's why I do that. And and it depends on some clients, some clients can do this within the first section. You can send this before the first session. I don't recommend it because some of the questions can be quite, triggering, right? So I like to do it with my client. Someone has a question? No, okay. Let me see, 1 second. So, and sometime, we'll have a bit of a break and then I'll pull up the assessment and show you how friendly it is, how flexible and accommodating some of the words are, right? And so I sometimes use it to really like engage and bridge a dialogue. When's the last time you had difficult sleeping, and just a couple of questions can really unfold a deeper understanding and dialogue with the client. So use it however is useful for the client and you. Okay, and so it doesn't have to be the first session. And sometimes I do a little bit of it, and then I do it the second session and the third session. So it doesn't have to be all in one session. Okay, so that's assessment, diagnosis, inventory measure. So, and then the first is crisis of safety. Often when I do supervision, that's the first question I ask. With this client, any crisis and safety issue that we need to address first, right? So it's important. So, for instance, if clients have had past suicide, right? Past hospitalization and so forth, how recent and so forth. So it's important to indicate that, and then it can help us to support the client to be. Can someone can you turn off the microphone, please? Thank you. So where was I? Where was I? I lost my train of thought. Okay, so I just gather myself here. Yeah, okay. It helps us to support client to be proactive in self-care. So then if we notice that was last week that they've had an attempt, so forth, then we go into suicide assessment, and then we have it's on Moving Forward website. I send Gary to one for adult, one for kids, and and then we can put a safety plan, or I like to call it a care plan, together with the client. So the next time, so having that conversation, clarity from the get-go in work with the client, help to establish some safety measures. So and me too as a supervisor, and Bernard, we can look at the notes and say, there's something urgent that we need to address. So that's the fourth. The fifth is SMART goal, and we'll review that, later. So then we have our goals, and then we have our progress notes. So that's that's part of the documentation. That's where you write stuff about your intervention. So in the progress note, a couple things to include. One is your intervention, client's responses to your to your intervention, and clinical observation, not interpretations, but clinical observation. Can you please turn off your microphone if you haven't done so? Thank you. And okay. So whoever just coughed, can you please X out your microphone? Can you turn off your microphone? Whoever just coughed. Thank you. Okay, and then 7, we also want to include strengths and needs of the client. Okay, okay. Next. Okay, all right. Oh, sorry, I'm going backwards. Okay, presenting issues. Here we go. Presenting issues can be written in past or present tense. So here's an example. RC discloses, but you can go RC disclosed. So you can use words. So in the presenting issue, you want to write more of what the clients are sharing with you, what the clients are saying. So RC discloses childhood trauma, and then I use a little bit of the client, I mean, so it's not. RC discloses childhood trauma, growing up in a home with abuse, addictions, and mental health. RC describes her childhood as, I use her word, craziness, right? And indicates that having some routine schedule in home has provided her with a sense of normalcy during her early years. RC expresses an understanding of blah, blah, blah. And let's go at the last sentence. RC expresses to raise her son in a safe, healthy environment. She states that she would like to, quote unquote, free herself from her past, gain control of her anxiety, live and enjoy life more fully in the present with her son, right? So I do add what the clients say, and that but if you look at this, if you look from the outside, it's all about what she says. So you can use words like states, indicated, disclose, express, report. Okay. Yeah, I think that's good enough. Some words. Okay. So I don't mind being interrupted. So just turn on your microphone. Stop me at any time and ask a question, unless it gets to be much, but that so I'm okay if you interrupt me and then ask questions. Okay, so remember when you go back.
Excuse me,
Yeah.
sorry, I'm just curious on one thing. When you use these discloses, describes, expresses, all this, just want to make sure these are just synonyms, right? We can use them as and where it fits, or like, is anything you would suggest?
I don't understand.
I'm just trying, so like, am I loud enough? Can you hear me?
Mm-hmm.
Okay, thank you. So what I'm asking is, you mentioned discloses and describes and expresses.
Mm-hmm.
Is there anything like, these are just synonyms, right? We can use anything anywhere, or like what kind of information or
okay.
things?
Yeah, these are action verbs, right? This is what the client tells me, so this is what the client described to me.
Right.
So it's not, so if I were to write clients, have this, client have, let's see, client has childhood trauma.
Right.
Client has health. Who is that? That's me. That's me saying it, right? So I would say client disclosed. So client's sharing with me, right? And client states that she does not like this and she does not like that and so forth, or this happened to her and that to her. So, so I wanted to document what the client, shares with me.
Right.
Yeah.
Got it. Okay. Got it. Thank you so much.
You're welcome. All righty. Okay, so where were we? So demographic, presenting issues, assessment and diagnosis. Okay, so So we did that. Okay, so remember those two assessments that I mentioned, the anxiety and depression. And so when you complete the assessment, there's a score. So in your documentation, write that down. A score of 55 on Burns Anxiety Inventory indicates severe anxiety. A score of 40 on Burns Depression checklist indicate moderate depression. Diagnosis unknown at this time. So just a bit short. Yeah. So in your notes, just write the um, the the results of the assessment, and if there's any diagnosis, known diagnosis, confirmed diagnosis, then put it there in your notes. Aha. Crisis safety. Discloses ongoing suicidal thoughts. Conduct suicidal assessment using SAD person scale. Result indicate low risk. Co-create safety plan. RC confirmed commitment to follow the safety plan when she feels overwhelmed with thoughts of killing herself. That's it. Okay. SMART goals. Okay. I'll go over this a little bit. I'll take a little bit of break, and then this piece is quite large. Okay, so goals. So 1, 2, 3, 4, 5 things to consider. That the goals are specific. First of all, are specific, well-defined, clear, and unambiguous. Number 2, that the goals are measurable. And we'll go over this, so not to worry, they are measurable, that they have specific criteria that measures clients' progress toward accomplishing the goals or goals, okay? That the goals are achievable and realistic and timely. Clearly defined time, including a starting and a target date or end date. The purpose to create urgency, the purpose of urgency and value, and also accountability for the clients. To be honest with you, I don't often use goals anymore. Having said that, in the past I used to use goals for clients who just have a lot of things to contend with. And I don't like to say that. I use goal when clients are all over the place. I think that would be seen as condescending. So so use whatever word that fits your language. So and also goals create accountability for the clients too. And it's like, okay, you come here, this is your work, this is your session. How would you like this session to be? How would you like this work to be helpful for you? What is it that you want to work on, and how do you want to achieve it, and when? Right? And having that check-in for the client creates accountability. This is their work, right? And I'm not going to be able to support them or no if they're not clear with what their intention or their goal, right? So that's one purpose of using goal. Another purpose also, it gives us some sense of direction, right? Now, we're very fortunate to be doing the internship and moving forward because, clients and our work with the clients can be like 6, 8 months, and then they transfer to another counselor. So it can be, quite lengthy. But when you work within an organization with a client, I mean, maximum time you have with them, perhaps 12 sessions, maybe 20 if you get that, right? So the need of goals and direction and accountability is very important, and so getting some understanding in right now doing your internship and practicing this will really help you, later on in terms of guiding your practice in other organizations. Okay. The only last thing I want to mention.
Can I ask you a question really quick?
No, pause here for a minute. Just a second. I just want to mention the last thing I want to mention about goal is this. The word goal can be quite clinical. Like, we don't kind of walk around, here's my goal. It can be clinical. So use the language that fits your client. So, okay, so if you ask them, what goals do you want to work on, and there's some resistance, change the language. So something like, You know, what is it? What's your hope? And what's your desire and dream? Okay, or what are you hoping to get out of, you know, your work with me here, right? So it can turn into hopes and intention or dreams, ambition rather than goals. Yeah. And okay, go ahead. Question.
Is that directed towards me? I'm guessing?
I don't know.
Oh, you can't
Right
see,
now,
sorry.
to be honest with you, I don't see any of your faces. And that's hard for me sometimes. I'm such a visual person. I only see the PowerPoint. So somebody asked me a question earlier, and go ahead. So
Yeah, it's just Amanda
I'm
Adler. Hi. I was just a little confused about something that you said. Were you saying earlier when you were introducing SMART goals, that you don't like to use the words, or that you don't always use goals with clients?
both.
Do you not like using the word term, or do you
Yeah,
just not use the goals at all with some clients?
I don't use. I work differently. I work more somatically now, so it's not goals for me.
Okay.
It's yeah. So when I used to work with goals, I don't necessarily, you know,
Mhm.
I don't usually formalize goals. I don't always formalize
Mhm.
goals with my clients, because some clients come like they've got it, they want to do this, they want to do that, and so forth and so forth, right? So
Mhm.
but some clients, I do feel that I need to, okay, let's just pause here. There's, we've been talking about this and talking about that and so forth and so forth. Now we have about 6 sessions left. Okay, let's
Mhm.
work on sort of like work on what is the word I use? Work on uh, more with a focus, with the next six session, because I want you to leave feeling that you've accomplished something. Okay, so for the next 6 sessions, what are some of the things that you really now would like to focus on that we haven't yet? So then I go into goals, right? So yeah, okay. Now, if you work for agencies, and especially now, if with moving forward doing internship too, Gary wants goals, so you're going to be doing goals, right? But you can now, and the word goals may not be a fit or friendly with everyone. If be cognizant that the word goals can be quite intrusive to some client. There's this expectation of like, well, the word goals already is it achievable, or something like, wow, I've always set goals and I've always failed. I've never achieved my goals. So so change the word, right? So yeah, so be cognizant that it's not always received well with our clients, and it doesn't then explore that with them. Okay? Yeah. Is that helpful?
Yeah, that was helpful. Thank you.
You're welcome.
Yeah, I have a question like how important it is for us to have a goal at a first session, because sometimes I feel like a client is really not in a position to have a goal, especially during the first session. Is it really important for us to have a goal for the counseling relationship?
Just like okay, okay, that's a great question. And how would I like to answer it? Okay. Again, these are things, especially goals. It's to help you and your client. And if you recognize that it's not helpful, then don't use it for now. Okay, so I'm just going to mention about first session, second session. Sometime I have counselors ask me, I mean, they don't, they're, the kind that's happening, the goals, they don't know what to work on. They don't, and I don't either, and so forth and so forth. Then instead of having an overarching goal, like I want to come and work on my relation, improve my communication, work on my relationship, reduce my anxiety. So if there's not much direction in terms of what they want to accomplish, the goals can be session by session. So for instance, so for this first session, okay, I know, so let's say, for instance, you've had several sessions and you're talking about, everything, this and that and this and forth. And then the third session, you want to have some goals, but not without using the word goals or having anything to measure, achievable, and so forth. Goal can be relevant session by session. So for instance, for this session, is there anything particular that's important to you that you really want my support with? Okay, they go, oh yeah, I want to blah blah and so forth, right? And if the client say, well, not in particular, okay, so what is it that you want to? So I'll ask him. So what is it that you want to talk about today, right? Just have a focus. Well, I want to talk about blah blah blah, right? And so that's also a go-to, because client can say they want to talk blah blah blah, but they come in, they talk about the neighbor, they talk about a phone call with their sister and the conflict, and so forth and so forth. Just then direct them. You came in, you wanted to focus on this specific issue. We have about half an hour more. Would you like to focus on this? Right. So again, it's just an invitation. So why that's important? Because it's like by the end of the session or by the end of our work with our client, we don't feel bad in terms of, oh my God, yeah, we didn't really work on anything, and that the client doesn't come with blaming, right? Oh well, I went to see this counselor, I don't think I worked on anything. We just talk, right? But if the client says that they just want to talk, so you want to make that a goal, clear. Okay, so for the next couple of sessions, you just want to be able to just share, and you just want me to just listen and give you some suggestion, feedback. Am I correct? Okay, right? Because if that's useful for the client, then that's a goal. But you want to make it explicit and direct, right? Yeah. So again, these are in place for it to help you guide your work, to be helpful. If it's not helpful, then, well, don't use it, I guess. Yeah, and we have to be able, to make that call with different clients. Yeah.
Radha, it's Demi here. I have a quick question that pertains to that as well, because I'm finding that clients are normally coming in with a variety of different issues and kind of unsure as to which one they want to focus on, or sometimes they might even say, I just kind of want to see how things go day by day. And I kind of like establishing that in that first session. Like if there's quite a few things happening, I try to narrow down if there's, if they have a vested interest in focusing on one or more particular goals, or if I'm kind of getting the vibe that there's a lot of things happening at once, I'm just getting the sense now, because I'm also just starting with clients, that I'm kind of going to see how the next session goes, because I don't want to also overwhelm them in that first bit, when there is issues.
Okay, the thing is, goals, having established goals is about not overwhelming the clients. I'll give an example. They can come in, they talk about this, they talk about that, and then you can, okay, so we have, for this session, we have about 40, half an hour left. It seems like, a lot has been happening for you. And, a lot of areas that we could, potentially look at, that I could potentially support us. But for today, or for the next several sessions, is out of all of that, is there like 2 or 3 that is most dear and near to your heart that you really want to work on? Or is there 1 or 2 that's quite urgent, right? And then you now you're holding the kind of, sort of inviting accountability, right?
That makes
right. And then the next session comes, we talk about everything under the sun except that. Okay, would you like to talk? You know, you like to talk about this? Oh, well, no, right, okay.
Yeah,
Right, you know,
you just,
and
yeah.
yeah, you know, you know, that, and just know that, you know, clients are where they're at because there's a lot. I mean, they hold on to a lot, and our role is to kind of like, disentangle the cluster of a lot of stuff that is more manageable. And sometimes we might ask them, as someone asked about the first session, okay, what do you want to work on? It might be difficult if they've experienced such a huge cluster of stuff. Where do you start?
Yes.
Right? And so we can begin that dialogue and just, that's a lot. And maybe it can be difficult to, kind of list, things in priority, right?
Mhm.
And
That's
just,
a good question.
yeah, and just
Oh, sorry, go
acknowledging,
ahead.
yeah, and just acknowledging that. And sometimes with that question, they're so overwhelmed, but then when we tease it apart, it's like, oh yeah, okay, the most important. Oh, so you can really help them to think a bit more concretely, one at a time, one step at a time. Before we get to goal number 5, what about number 2, 1 and 2, right? Then that really helps them to, okay, I think I can do that. Because if when we ask for goal, they'll probably jump into goal number 10, from 5 and 10, right? And that can be so overwhelming. Let's start with goal number 1 and do some kind of helping to, create the more basic goals before we get to the 5 and 10. Does that make sense? Right?
Right.
So
Yeah,
this is
that makes sense.
not to overwhelm. It's really disentangle and tease things apart so they can see things individually, one at a time, more manageable.
Yeah.
Again, realistic, achievable, right? Specific and timely.
And actually, when you say that, when we're listing, because it makes sense in many ways, like during the session, in terms of the clinical documentation portion of that, it could be that if there are in fact several goals, to kind of list them off, and then at the end kind of specify which ones need to be, or which ones the client wants to complete initially, or perhaps ones that are more time sensitive could also be the ones more priority, to kind of help gauge what that looks like.
And
just to guide you.
Yes, and sometimes some clients are used to having so much. Well, let's not do anything because it's just too much, right? It's just, or and so here we are. It's like, no, it doesn't have to be too much. It can be, this, it can be that, it can be this, right? And just, getting them into a routine of addressing small pieces of this huge cluster of challenges in their lives, right?
Yeah, that makes sense. And it can also guide you so that you know where to go for the next session if you leave a note near the end of the goal section and say, okay, this is what we kind of discussed working on, so you can at least know where you kind of left off, so you can at least address it if it doesn't get addressed. That's helpful. Thanks.
Yeah, and I often get this question. I'm mindful of my time. What time is it? Oh my goodness, we're almost done. Okay, and I often get this question from a lot of the counselors I support. Is okay, Radha, I'm stuck. I'm stuck. I don't know what to do with this client. There's just so much. I'm stuck. I don't know where to go next. My response have always been, well, of course you're stuck. Of course you don't know. It's not your work. It's the client's work. I know the client comes with an expectation for us to know, and we also come into this work with an expectation that we are to know, right? So this helps, the goals helps to formalize clients knowing, right? Yeah, and so if ever in doubt, you don't know where to go, what to do, just ask, let the client know. Well, for the last, for example, for the last several sessions, you shared about a lot, you've gone through a lot. This happened and that happened and that happened. So, for today and moving forward, I'm feeling a little bit stuck, unsure as which of the best way I can support you with, or which in particular. Do you have any thoughts in terms of what you need my support with. Which direction should we go next? There's a conversation in terms of structuring goals, right? Right. So we work in we do not work in isolation. We work in collaboration with our clients. Right. So engaging them, and they may not used to, and that's okay. Right. We all learn new things when we come to counseling. Right. Yeah. Okay. Okay. So number one, that the goals are well defined, clear, and unambiguous. So specific. Okay, so sorry, the first one is specific. Here's one. Okay. Goals that are specific have a significant greater chance of being accomplished. To make a goal specific, the 5 W's, the 5 W questions can be considered. Ask the client, who is involved in this goal? What do you want to accomplish? Where's the goal? Where is this goal to be achieved? When do you want to achieve this goal? Why do you want to achieve it? Okay, so these questions may sound a little bit sterile, but we're gonna come up with a goal together, and then we're gonna dissect it, together. So I'm just mindful of my time that we can do this before you leave today. Okay, so I'll just run it through, and then we'll kind of come up with a goal, and then we'll go through this together. Okay, specific, measurable. Goals must have criteria for measuring progress. If there are no criteria, the client will not be able to determine their progress. And if they are on track to reaching the goal, to make the goal measurable, ask the client, how will you know when you reach your goal? Keep that in mind. I ask the client a lot. Okay. Question 2: what would be your indicator of progress? Okay. Example. Here's an example of a goal that is measurable and specific. I would obtain a gym membership at my local community center and work out 2 days a week to be healthier. Every week, I would aim to lose 1 pound of body fat. See how specific that is, right? Yeah. But it breaks up the behavior. So the action into concrete, manageable, right? Rather than I want to lose weight, but I'm not going to be able to. I don't know where to start. Here's where you're going to start. Yeah. Okay, measurable, achievable. Goals must be achievable and attainable. This will help clients figure out ways they can realize that goal and work towards it. The achievability of the goal should be stretched to make clients feel challenged, but defined well enough that they can actually achieve it. As a client, do you have the resources and capabilities to achieve the goal? If not, what do you need to achieve this? Or what are you missing? Okay, and okay, so here we are, that the goal is achievable, right? Realistic. The goal must be realistic, that the goal can be realistically achieved given the available resources and time. A SMART goal is likely realistic if clients believe that it can be accomplished, right? As a client, is the goal realistic within your reach? Is the goal reachable given the time and resources? Are you able to commit to achieving to your goal? Exactly. Are you able to commit? Timely. Goals must be time bound in that it has a start date. If the goal is not time constrained, there will be no sense of urgency and motivation to achieve the goal. As a client, does my goal have a deadline? By when do you want to achieve your goal? Example, On August the 1st, I will obtain a gym membership at my local community center. In order to be healthier, I will work out 4 days a week. Every day, I will aim to lose 1 pound of body fat. By the end of August, I will have realized my goal if I lose 4 pounds over the course of 1 month. There's your goal, the end. That's it, right? You take it in little pieces and then add and make it specific and make it clear, and there's time attached to it, and how will like I'll give an example. When client says, I want to manage my anxiety, I want to stop having anxiety, I want to reduce my anxiety. Okay, so that's your goal. Ambiguous, but we'll work on it. But some questions kind of like, well, how will you know that you have managed your anxiety? Okay, I would be able to go out of the house or go to the shopping center, I would be able to go. And then when my anxiety come, I can actually, use some techniques to reduce it, right? So that's it, right? It's within the client's experience. How will they know that they would achieve this goal? Okay, so where am I? Let's work on a goal together. Let's throw out a couple goals. Time, you know what? With the time, let me just whip through the progress notes, take a 5 minutes break, come back, and let's work on a couple goals together. How does that sound? Good? Okay, so, all right, so we are into the progress note now, but we'll go over the goals again. So progress notes. Progress notes contain 3 elements: clinical interventions, clients' responses to the interventions, and clinical observations. Okay, so first, here we go. Clinical, okay, so here we go. Describe intervention, action step implemented by the counselor. What's an example? Okay, haven't seen this for quite some time. So in the progress notes, so clinical interventions. Okay, describe clients' responses to the intervention. So the first is describe intervention, describe clients' responses, what the client is working on, and what they have discovered or accomplished up to this point. So that's a progress, okay? And then thirdly, to include is describe clinical observation, not interpretations, opinions, or judgment, okay? So here's an example of a clinical intervention in our notes. Of creative methods and techniques counselors use to help the client make progress. Action step used in treatment plan to assist client in reaching their goals. Okay, let's go back. Sorry. Okay, so here it is. First is interventions, a clinical intervention in our notes. Then clients' responses and clinical observations. Okay, clinical interventions, action word, discuss, explore, brainstorm, implement, conduct, etc. So here's my example of a clinical intervention that I include in my notes. Provide psychoeducation on how past trauma experiences impact her current functioning. Conduct mindfulness and breathing techniques for self-regulation. RC was able, so here's the responder, RC was able to reduce her anxiety in the session. She expresses a noticeable difference after experiencing mindfulness practice. RC expresses a keen interest in practicing self-regulation technique at home to better manage her anxiety when it comes up. Provides, there should be an S there, but okay, provides homework, so that, okay, that's what my intervention, okay. RC states that she plans, so now I provide my intervention and then, sorry, where is it? Oh shoot, no, sorry. Okay. First I did the intervention, now client's response, right? So that's the client's response, right? To my intervention in the session, clients respond. Now here's my intervention, I provide homework. Now my client's Response, RC state that she plans to review CBT worksheets on anxiety and practice applying the skills. She also plans to review self-compassion strategy via YouTube videos, right? So again, it just, it just highlight what we apply in the session, how the clients respond, right? Or, and it doesn't have to be positive. I mean, it can be however the client's response, right? Yeah. Okay, clinical observation, here example. Clients appeared extremely angry in group, or client appeared extremely angry in a session. Sat with fists clenched and rigid posture. When asked to talk, client refused. An example of an opinion or judgment by the counselor. Client was hostile toward others and looked like he was ready to hit someone. Client probably drank last night. See the difference? Yeah. Documenting clinical observation is important. Documenting opinion is inappropriate. Okay. And then
Ratha?
remember, yep.
This is just Cody. I was going to comment for anybody interested in that. There's something called the mental status exam. And if you just Google search mental status exam, there's some really good descriptions out there of how to write your clinical observations in a structured way. And it's guidelines and everything. So
I remember that email you sent, Cody. I remember that. And did Gary not put that on the Moving Forward website that people can access?
honestly, I don't remember sending that email, but I do know that there's lots out there if anybody wanted to Google search, and it's in line with what you're saying here too. And I found that helpful in my notes.
Okay, thank you, Cody. I'm pretty sure. Okay, I somebody sent it, and Gary shared a mental status, whatever. Yeah, Gary shared sent it last year, and I thought it was awesome. And I thought Gary had put it on the Moving Forward website, but yeah, sure. Okay, thank you, Cody. Okay, and then lastly, client strength, right? Also add client strength and needs we can add this in progress note. Supportive, they are, they attend, regular sessions, right? And also, yeah, connected with that. So all of those resources, right? Needs. Needs is something that still need to address and work on. And so a long time ago, when I used to see more clients and currently, and especially when I work in an organization, it's very structured, right? I'm working now on my own in this less structured. I mean, and there's always a strength and limitation to both, right? So with organization, I tend to end my session more in terms of conversation about client strength, and often in the beginning, I used to work for whatever organization. I would list strengths with them, and I can see the difference in the beginning of the session. It was a client would have really struggled to come up with a list of strengths, and how wonderful it is at the end of the session for them to don't have much challenges, that they can actually express their strength more automatically, more internally. So and sometimes I add a couple of strength in terms of my experience with the client. So often when we end, I always like to end with gratitude in terms of asking the client some of the things that they appreciate about themselves and their process, and also what I appreciate in them, and our process, together. Why that is important? Because, well, we all come to this work and about change, right? Solution. And so it's important in your session to bring those in as well too as addressing issues or things that happen work. It's also important to also, take some time to look at things that have worked, that have progress and their strength as well too throughout, the session, because this is where we want them to be, and this is where clients want to be, right? So having that conversation and expanding that conversation and that experience in a session, it can help to create a new pattern, right, of change. Okay, so that's all I have for now. Let's
I have a question.
Sure.
Like these strengths and needs are goal specific, right? Or just specific to the whole counseling relationship?
I'm sorry, say this again.
These strengths and needs are goal specific, right? Or are just in the context of complete counseling relationship through?
Oh, I see. Any way that you find is helpful for you and your client. I mean, yeah. I'm not going to say I don't work well with rules, but anyways, but however it is helpful for you. I think each, maybe after a couple of sessions, I like to talk about some of their strengths, right? And also, include in my notes, because other counselors can come in and it's not just focusing on the problem, but focusing on the strength and I think that's important because that is the key. That's we want to highlight. We want to continue to strengthen, right? So have that in your notes, have that is in your goal, have that at the end in terms of conversation, right? We're so used to, some of us who've gone through a lot of stuff, and some of us who have gone through a lot of counseling are used to or familiar to talking about difficult stuff, talking about issues, right? Talking about issues, and it can, and that's what we're all here for. But it's important to not forget the things that have worked. They can be it's just among chaos, but for me, the conversation. Oh, okay. So what has kept you going among all of this chaos? Here's the strength, right? What has kept you going? So I often like to start with that and halfway bring that in, and at the end remind ourselves of that. And so the solution, the strength is from within. A client comes to see us, they're reaching out from without. I always turn the back for them to reach within and among their resources, right? In the community and things like that. Yeah. Okay. So what time? Let's take a 5. What time did I set this? Right. Can you see that? Okay. Okay. Someone volunteer to give us a goal to work on, please.
I can volunteer. I have a client that says that they want to be less angry, less anxious, more happy, and wants to change jobs and make friends.
That's great. Okay. Less angry, less anxious, more happy. What else?
Change jobs and make friends.
Change jobs and make friends. Okay.
Ratha, sorry to pop in here. I just got a message from someone that got kicked off somehow. And they're in the waiting area. I don't know if you can see that.
Oh, okay. Let me unshare. Thanks, Gary.
Gary, was it Jocelyn or Jasmine?
No. It was
Okay.
Marta.
Okay, if it was, then she's not gonna come back, but just FYI.
Okay, thanks.
Oh, okay. So I can go ahead now?
If you are, were you able to let that person in?
I don't see her, Gary.
Oh.
Okay, well, let's spend a minute to find.
So the reason why my customer was gonna join is because the room was actually locked. No one can actually be in the waiting room or anything.
Yeah, I didn't do that. Yeah,
So
I
don't
didn't
think there's
set
gonna
that
be-
up.
Yeah, I don't think there's gonna be anybody in the waiting room at the moment.
That's good to know.
Okay, so yeah, I have no idea how that works. If it's
Yeah,
locked.
me too. I certainly didn't do that, but that's interesting. So I'm gonna look into that to make sure that next time, yeah, but
Wonder if it's because I'm recording it. Does that make a difference?
yeah, because that actually never happened to me before where somebody said you locked it. So maybe I know that, you know, when I share PowerPoint and somebody pop in and I let them in, my PowerPoint freezes. You know, it's